Welcome to our podcast, Social Workers in Trenches.
Hi, everyone.
Hi, everyone.
So, before we begin, just a quick note this podcast is for educational and informational purposes only and is not a substitute for legal, medical, or professional advice.
Absolutely.
Today's topic is how do we start conversations, supporting loved ones, and remembering your own needs. There's one thing that caregiving does. It's always starts with one task. I need to make a phone call to a doctor. Can you do that for me? Can you pick up medication from a pharmacy? And then it leads to sometimes paying some bills, sometimes going to some medical appointments. And one of the areas that's we don't notice initially, right, is doing those small tasks. There's a AARP had come out with the statistics. 1 in 5 adults are currently in caregiving position.
Mm,
So many of them are balancing work and family responsibilities. And what's called sandwich generation. They have to take care of their elderly parents or a family member, and they also have their families. And on average, is caregiving takes about 4 to 5 years. And then what happens is that because we don't recognize in our society that caregivers takes toll on people, right?
hmm
And so what they found was that 40 to 60% of caregivers experiencing emotional stress and depression,
And burnout.
Yeah.
which leads to burnout, work performance issues later on,
hmm
and sometimes we have people have to quit
Right.
jobs and to focus on their loved ones' care.
I would probably say that that number, that 1 to 5, is probably more. Because here's what I know individuals who come from cultures like myself, Caribbean cultures, sometimes Spanish, Italian cultures, where it's been generationally where you take care of your loved ones, right? You take care of your mom, your grandma, your grandpa, great grandmother. You don't put them in a nursing home. You leave them at home and you provide care for them at home. And it's everyone's responsibility, not just the parent, not just the adult children, right? It's the whole family's responsibility. So I would probably say that number is more than that based on cultural beliefs.
But it doesn't always work out that way, right? Because
Right.
there's usually one person that takes over the job.
Right.
Like you hope that everyone participates,
Right.
but not how it always ends up,
Right.
Right,
which
which is
leads into what you're bringing up.
Right. The
this-
burnout.
right, which just leads to actually number one problem: not
hmm
having the conversation beforehand, during, and then the other part of it. Also, I feel like not knowing what your parent or loved one or someone who you take care of wants. Because we did have the conversation beforehand. And it tends to happen during crisis. And as the crisis
hmm
happens, then we have to figure out what we're doing, right?
Right.
So then, I mean, the first question becomes, right, why is it so difficult to start a conversation,
I think
especially before when things change?
I think sometimes I would always go back to fear. And sometimes individuals just don't believe it's the right time, right? Well, it's not the right time. Nothing is wrong with me right now. Let me not start talking about it. If I start talking about it now, then something might happen. So a lot of time that fear of what if something does happen? I don't have enough money right now to make the plans. But the thing is, you're basically saying start the conversation. You don't have to have the finances, you don't have to have everything line up in a row, but start the conversation. Because how would you know that your mom or your dad or your grandma or your grandfather wants to be cremated and not have a funeral where they're going to the ground?
Like, this is like you're going from zero
So
to
100.
cremation to death. I think we need to go back and center on a before that ever happens. Like,
Uh,
we're gonna talk
the
about
health, the health crisis, the health crisis.
right, even
Mm,
before that, like, conversation becomes what is important to me, right?
right,
Mhm.
right,
Is it
right.
about autonomy? Is it about independence?
Right.
Can I say something? Because I've been thinking about this question long and hard. You know that saying, like, get busy living or get busy dying? I just don't feel like people are thinking about dying, right?
Right.
I mean, I know that it could be a cultural thing,
Right.
where it's bad luck to think about those things or to even talk about them. But I think people, one, don't have time to think about it, don't want to think about it. Um, they feel invincible, as Zoe was saying before, like, now's not the time to talk about
Right.
it. Um, but I think there's a big part of people that are just like so focused on life right now that that's just like something that's going to come later. And you hope that it comes in your older age, right?
Right.
It doesn't always happen that way. And we don't want to think about our parents or our loved ones getting to that point. It's just not something that's on our minds because I can't make sense of why people wouldn't have that conversation, right? Like, well, let's talk about, if mom gets sick, if dad gets sick, if I get sick, why aren't we talking about it? It has to be that just maybe no one is really ready to think about that part of life. And I
Right.
hate to like make it sound so like sentimental and like, but it's the truth. Who wants to think about it? Why go there?
And a lot of times, guess what happens? They're not even thinking about it when they do get sick, right? So you go to the doctor says you're sick, you need treatment, you need to start making some plans, you need to kind of restructure the way you're living, right? You need to start living better. Start eating right. Start taking care of yourself. Start exercising. The doctor give you like a whole blueprint of what you should do to live a healthier life. And even at that point, most people still don't have the conversation. They don't even listen to the doctor half the times. They
Mhm.
continue living, drinking, smoking, drugs, eating all the fast food, doing whatever it is that they've been doing before, as if like, okay, that doctor doesn't know what they're talking about. That doctor doesn't know my life, doesn't understand my family dynamics. But sometimes by the second or third hospitalization, sometimes the reality sits in. I'm like, maybe I need to change my lifestyle or start having a conversation with my loved ones.
But here's the other part. I don't like comparing when we're going younger to elder, but there's a part of this dynamics.
Mhm.
We ready to have a child. We give birth, and then the child appears, and we have to make decisions with them. And
Right.
if we have a partner, then we have to figure out how to have a conversation about child rearing, and then making those decisions, make it together. But think about this: as we grow up and become our own adults, and then our the parents become elderly, maybe start sensing challenges in terms of their memory.
Mhm.
But then it means I have to make decisions for them. Do you think in our society we talk more about that aspect of decision making? Ability as a daughter or son, now I have to make decision for my dad or my mom or aunt or uncle. And then that's not something that comes naturally. You could plan for the child, and then you could, there's usually planning around it happens. When it
Right.
comes down to the aging or when the person, there's health changes, we're rarely thinking about, well, how do we make decisions
Right.
for that person and
Right.
what it means?
Right.
I think that's part of our other conversation. If I have to make decisions, what kind of decision I would like to make
Right.
for them?
Right.
How do they like to live their lives? What's important to them, right? And it goes back again. Do I want that responsibility?
I
And I
think
think
sometimes go ahead.
and I think that's part of it too, when people feel more stressed because sometimes
Mhm.
they just fall into that and they have to like, okay, I have to like make a decision, I have to do this now without even considering or thinking or stepping back, saying, hey, what it means.
Mhm. I think sometimes it's also from family dynamics, right? I see in my line of work and in my years of dealing with young and old and seniors and all different ages. One of the things that I see a lot of is if you had a great relationship with your parents, you're more apt to step in and figure out the things you need to do to do that role, to become the caregiver, or to figure out a system to make them safe, or whether it's a home health aide or following up with the doctors or whatever the case may be. But I find when there's not a positive relationship between parent and child or parent and grandparent, what ends up happening is it takes longer for someone to step into that role of caregiver.
I'm going to agree with you on that. But also, I'm going to go back to what Alexi was asking. People, are really asking themselves, like, what this entails. Like, if I
Right,
become a caregiver, like, oh, yeah, I can step in with like the appointments, picking up medication, going
right,
to visit. But when it becomes a much more serious illness where
right,
you have to give up a job,
right,
what if you are the primary provider for your home and you have children? Your job isn't set up to allow you to take a certain amount of days off, or maybe you've used up all of your vacation and sick time. I think that's when it gets real, when you're like,
right.
wait a second, I actually have to give up so much of my own life to take care of this person, regardless of how much you love them, or how good they were to you, right? It's like, wait,
Mhm.
what exactly what exactly did I sign up for here? And I think that's when, and also, how sick is is my loved one? How long is this going to last? I
Right,
could do this for a little while, but when it becomes like, oh wait, I have to take care of them forever until the day they
they pass
pass.
away.
Like, this
Right,
is now my job. And I mean, there's a lot that goes into that emotionally, financially, physically, mentally. There's so much. And maybe we could even say that that's why people don't talk about it or bring it up, because it's like, I'm not in a position, even right now at this moment, to
right,
have that conversation, because I know that I'm not well off in life enough to actually take care of anybody else that lives outside of my home in
right.
this moment.
And that
Mhm.
is why having the right resources is so important. Having the right connection, asking the right questions. Because in the real world, we know this happens all the time, but it doesn't necessarily have to happen that way. If you know that this person is entitled to a certain amount of hours of home care, you can advocate and apply for those home care hours. If you know that someone could go and live in assisted living and have medical care, round the clock nursing care, you might opt for that option. So there's lots of different ways that as a caretaker or a caregiver, you can say, okay, I want to help, but I can't afford to give up my job, especially when you have young children, or especially as you say, if you're the breadwinner, if you're the person who's paying all the bills, you can't give up your job. So you have to start asking the right questions, seeking the right type of help to help your loved one.
But wait a second. We're all social workers. We're
Mm.
studying in this field. But Barbara, before she became social worker, she didn't have that knowledge.
Right,
Mm,
She didn't know where to go to ask for help
right.
or who to
Hmm.
talk to. That she may have some neighbors, maybe someone, coworkers, maybe they're going through.
mm,
But if no one have conversations on that, on
Right,
the job, right? Oh, I'm take care of my mom. It's really tough. Who do you ask for help, or how do you go about it? Asking. How do you know what's existed?
right.
right,
I'm gonna get a little personal. So, I mean, my mom is still alive, thank God, but she was sick for a little while, and we did not have the best relationship. We still don't. But that doesn't mean I don't love her and that I wouldn't help. So when it came time to ask those questions, who I did ask was actually my therapist. I explained the situation, and she was more than willing to give me information. And, we came up with a whole plan as to what I would do and where I would go,
right.
if my mother was in a position to not take care of herself. And she also told me, ask all of these questions, ask her what she wants, because it is still about autonomy, right? Even though,
Right.
you know,
Absolutely.
So I feel like I was fortunate enough to have that, but I wasn't afraid to ask those questions at that point either. It's like, what do I do? And so I did have someone to guide me. And I still have a plan set up, and I did ask my mom all of those questions. Some things she wasn't ready to discuss, and she said, "I leave that up to you," which is a big responsibility, right? Because I might have like 50 of my family members fighting me later saying, "No, this isn't the right thing," but
Mhm.
I can at least say, "Well, no, I'm her proxy," and
Right,
he left these decisions to me, and I know exactly what she wants and what to do. But you're right. I didn't have any conversations about this before. It was very new to me. And yes, in my field of work, I do see, people going through this. And I didn't want to end up in that position, which is why I said, you know what, let me just ask this person what she thinks of this situation. And she was educated enough to be able to help me. But yeah, that's another great question. Where like, who do you turn to? Maybe, and it was a little embarrassing. Like I had no one to ask. I didn't even want to go to my family to talk to them
right,
about, because of their relationship with my mother. So that was a tough one. But I feel like I got lucky,
right.
at somewhere to turn.
So I think if the person is having a health issue, it's not that the doctor is the right person, but I think I would start there with the doctor.
Mm-hmm.
Once you find out that the person has the health condition and the person is like, I can you go with me to the doctor's appointment, or can you call my doctor to schedule X, Y, and Z? I think the first thing, once you start going or understand what the issue is, to start having a conversation with the doctor's office. You have to first identify that there is an issue, that I need help, and I can't do this on my own. I don't know what to do. And then start asking the questions. I would start with the doctor, and the doctor might say, well, I'm not really sure, or, have you tried social services?
Mm-hmm.
Oh, there's a social worker in the office. Let's try speaking to the social worker. So again, you might not initially know what to do, but once you find out what the issue is, whatever the health crisis is, I think you should start with the doctor. That's
Mm-hmm.
just my opinion.
Mm-hmm.
If you have someone, a close friend, who you reach out to when you find yourself in crisis. If you don't have access to social services, you've never been part of that, you never had access, you never
Right.
really help through
Right.
social service agencies, then
Hmm.
you may not know what's source available for
Right.
assistance for yourself
Right.
or for your family member.
I was just going to say, or if you're part of a church or community organization, you speak to one of those leaders to say, hey, I'm going through this situation. Has anyone in the congregation or anyone in the community been through something similar?
Mm-hmm.
What are some of the steps I should take to make sure that I don't get burnout? Or what are some of the things I should do to help my mom or my dad be stable in this time when they're dealing with this issue?
Right. Because then it
But
goes
sometimes, sorry, Lexi.
back.
Sometimes I feel like, even with all the resources, people sometimes are still afraid to say, I don't know
Right.
where to turn. I don't want to ask. It's
Mhm.
about being able to ask for help.
Mhm. Mhm.
So what makes it difficult to ask for help?
Pride.
And I mean, yeah, who knows, right? Because we don't live in everyone's mind. We're not
Right.
have the same experience, so we don't know what makes it a person not want to ask for help. But yeah, I would say pride or
Of
fear
fear.
or just maybe not accepting what is happening, being
That's true.
unable to say, you know, they're going to die or they're going to need a lot of care, and maybe saying it out loud sometimes it just makes it so
Real.
and just like, definite, like this is happening to me. So I think it's also about accepting the situation and being able to stand strong. Some people are not built to handle certain situations. That I have realized, and we will never be able to live some of their moments.
Mhm.
There's a
Mhm.
judgment. Do you think there's a judgment when we ask for help, when we ask for assistance, when we ask and not just a friend or coworkers, but sometimes asking for help, going to, let's say, HRA and
Mhm.
say, "Hey, I need help," and, uh, and then not getting that assistance or being looked down or be denied, and then says, "No, we don't help you with that." And so someone did not sit down with them and say, "Hey, this is why we couldn't help you," or kind of redirect to more appropriate service that could help them to address some of those issues. So,
Right.
do you feel like sometimes when we do ask for help and we don't get the help, or we get brushed off,
Mhm.
that could
I think
also
it's a sorry. It's a feeling of defeat, right? Like I raised up to the occasion and I asked for help and here I am being shut down, or here I am I have to go and deal with these systems that, have a bad reputation. Um yeah, I mean it gets complicated. I would assume you feel like you're in a maze and that you're on an island by yourself and no one's going to save you.
Mhm.
I'm sure some people have better experiences, but you just never know what you're gonna get when you walk into these
right.
facilities.
Well, in New York, right now, if you need home care services and you never had before, you have to go through independent assessment, and you have to meet certain qualifications to
Right.
qualify to make sure you can no longer do certain things.
Right.
If you don't meet those, because it's very strict requirement now, because it's based on functional needs. If you could do
Mhm.
it on your own, you could still get dressed, you could still cook for yourself.
Mhm.
You just need, let's say, take it to a medical appointment, some go either get shopping done,
Right.
clean around your home. That's not enough anymore to qualify for home care
Right.
service. And so now you're stuck because even though you do recognize you need help,
Mm,
you said,
mm,
need help. I have this Medicaid. Now I could get assistance. And then you were told, well, you're still healthy. You're
Right.
mhm,
still functionally
mhm.
able to do
Right.
things. And
Mhm,
therefore, you qualify.
mhm,
And then it lives on the caregiver. They
mhm,
pay, which could be
mhm.
costly, or you start taking care of them and then provide support in terms and help them to continue living in the home. And so I think that becomes another conversation. And then what I've seen is that people not having that conversation after that happens. You get denied. What happens now? How do we take care?
Right.
And then the other person that was supposed to be receiver of home care feels like now, well, I don't qualify, so why even bother with that? Why do you even bother asking? Don't
Well,
worry about me. The framework of that conversation becomes how do we can make this work, right?
a lot of times you have to do an appeal or you have to have someone to advocate on your behalf. And it can become very daunting because in my own life, I think I went to social service twice, and I was denied both times. And you keep saying to yourself, what is it that I have to do? I've worked, I've paid taxes. How come I can't get any help? So I think a lot of times the person either gives up and they say, well, that's it. They denied my case, they denied my claim, they deny my need. And they become so stressed out that they then say, okay, well, I guess I asked my family. Or sometimes they don't even ask their family. It's when they end up in the hospital that the family realize that something is really happening because
And
they've been handling all of it by themselves for a while. Right? But I'm going to go back to what you said in the very beginning. How do we start having these conversations? And I can't say it enough. I said it in the first episode. Families need to start having the conversations the minute you start having kids and the minute your kids could understand your English, Spanish, Chinese, whatever it is that you're speaking, that at some point I might need help. Whether it's at 50, 60, 70, 80, 100 people that I know is living to be 105, at some point I might need some help. What am I expecting you to do? Or what am I'm going to say what do I need or what would I want? And again, what I might need at 50 now that I'm 51 might be very different at 61, right?
Right.
Or 71. So it depends. But I think it's important to keep having the conversations openly and honestly. And remove the fear, remove the stigmas, remove the death sentence of, oh my God, this woman keeps talking about death, or this woman keeps talking about being sick, the stigma that goes along with these conversations. No, just have them openly and honestly, whether it's once a month or once every quarter over Sunday dinner. So it becomes a normal part of your existence. So it's not a surprise when you call your family and say, hey, I need help. Or it's not a surprise when you say, I have to talk to you guys about my health and something is happening. I need assistance, right?
I mean, I think yes to everything you said, but I also think that, um, obviously people who are able to set themselves up financially and have healthcare and have already thought this through, um, they probably made their plans already. I feel like the people that we're trying to reach or the people that we're talking about are maybe the ones that aren't so financially stable, that don't feel like they can really, like, hey, I can't really plan my life. How can I plan a death? Right. So I think we just have to be mindful of like, what population we're really talking about because, people that are well off probably already figured this out.
And I'll be honest with you,
Oh,
Barbara, I
that's
work with a lot of people on both spectrums, those who have money and those who don't. And I'll be honest with you, there's a lot of people that have money who has not thought about getting a funeral home or planning for the next stage of their life. They just don't want to think about it. They're like, I do not want to think about it. And then when something emergent happen, some kind of tragic incident occurs, then they're all scrambling. And I'm like, this could have been prevented 10 years ago. This could have been prevented 15 years ago. I was having a conversation with a hospice nurse recently, and I said to her, I said, "Isn't it crazy?" And I was asking, I said, "Do you guys ask the families to have funeral arrangements already in place when they're coming on to hospice?" She says, "It would be best practice for them too, right?"
Mm,
Um, of course, I said, because craziness happens and the person ends up dying. And then at the last minute, you have to call somewhere to get funeral arrangements set up. She
mm,
says, unfortunately, this is the time we live in. Guess what happens? If it was going to cost you $10,000 10 years ago, now it's going to cost you $20,000, $30,000 right now because they
mhm,
have to stop what they're doing. They got to reschedule. They got to come pick up the body. They got to do this. They got to do that. She's like, I just don't know why families don't do it the
mhm,
first time.
and and I think that's goes back to conversation. Why we don't have those conversations, and I
mhm,
think and I think sometimes it starts with me, with what's important to me today
Right.
when I'm 20, 30, and then and if you start thinking about it this way, if you ask a question, what's important to me, you write it down in a journal. Where are you right now? And then 5 years from now, you do the same question and you write down again. 5 years later, you do the same question and write down again. And you look back, let's say in the last 15 years, right?
mm,
You may think things could change or stay the same. And you start doing that. And then the second question asks, what's important to me? Who can I share them with?
Right.
And that could be a starter conversation. That could be a starter point. And then the third question could be, what I care more about if if my health changed right now?
Right.
mm,
What would be important to me? And so those three questions, if you write them out, and every 5 years we review them and share with someone, so they could move forward. That could Those three questions could be a change how we view things,
mhm,
Right.
and it opens conversation about life. Because again, as you know, it's I don't think it's about death. It has to be always be about life because
Life.
till the last drop of your breath, you living.
Right.
So whatever that kind of life it would be. There's another point that
mm,
Barbara had brought out about, rich and poor, and I think, and the
mm,
people in the middle in terms of income, in terms of do we
mm,
have or don't we have. I think money allows us to access care to be different.
Hmm.
versus when you struggle to pay your bills.
Right.
And then people have the retirement account and you have $500,000.
Mhm.
Mhm.
Then once you need care, you have to spend down that money first
Absolutely.
before you
Right.
can access Medicaid. But that's where it becomes a conversation, right? Again,
Right.
Right.
understanding how who do you asking for assistance, or you just feel like, oh, I do have the money, I could hire someone to do it for me for a couple hours
Right.
a day,
Mhm.
which then leads to over 5 to 10 year period you spend down that money. But I don't think as always
It's
said,
fine.
the conversation may not be there.
Right.
Brings that case, the famous case that we all had, we've heard about, Bruce Willis, right?
Mhm.
And
Mm.
his wife, Emma Willis. And there was an issue where when Bruce Willis was initially diagnosed with aphasia in 2022, and then later he was diagnosed with
Frontal
frontotemporal
lobe.
dementia
Mhm.
in 2023, which is a degenerative brain condition that affects language, behavior, and cognition. And at the time, they decided, yes, they had the money and they had ability, so they should put him up in a separate house on the same land from them because of his health and how that affects his behaviors and impacts it could have on the family.
Mhm.
Mhm.
One part that she stated is that the doctors have informed her, which is to Zoe's point of view.
Mhm.
She asked a doctor, and they said that you need to create boundaries,
Mhm.
and you should do that because it will help you to manage your own needs, and also
Right.
while maintaining and creating that healthy boundary while taking care of him, but also having a support system around that who will be there 24/7.
Right.
Right.
So that person that she didn't get burned out,
Right.
right?
So
Absolutely.
she got a lot of criticisms for that.
Mhm.
And so the question becomes, this would have been a great opening in one way of
Mhm.
what it means to be caregiver, what it means when you have a very degenerative condition, or it's a neurological condition. And then the other part goes to take care of him, while also take care of the family.
Right.
Mhm.
Instead, the focus became she abandoned him, right?
So
Mhm.
so I'm thinking that people are feeling that way because they're like, she has the money. Why didn't she do X, Y, or Z? Or I always say, put yourself in the other person's shoe. It's great for us to have our opinions and criticisms and whatever they call it. But I say put yourself a day in the person's shoe and see what it is that you will do. Because a lot of times we have opinions, but when it comes to us, we're not making the sacrifices. We're not jumping over hoops to help step in to provide this level of care. Being a caregiver is like being a parent. The saying, once a man, twice a child, right? So now you're now the parent of your parent, right? You're now making the decisions, you're now making the calls, you're now wiping butts, you're now giving showers, you're now cooking, you're now giving medications, you're now up at night if they're demented and they're trying to leave the house. So, my thing is, before people criticize and before people have very strong opinions, which I can't stop people from having, put yourself in that person's shoe and say, what would I do if this was my mom? What would I do if this was my wife? What would I do if this was my husband? What would I do if this was my dad, grandmother, whomever? Would I step up and stand in that role as a caregiver and use my resources to provide adequate care?
I mean, I'm gonna say, she was definitely fortunate enough to be able to, because I think she was caregiving in the beginning, and then she just
Mhm,
hired this team to kind of take over because she was experiencing burnout, which I think was smart on her part, right?
mhm.
And she was fortunate to have this team, and he had a big family. I think either way they were going to be okay, because they were just in that position. You know, in terms of her doing the right or the wrong thing, I think in the end she did what was good for her
Her?
and, for her own sanity, for her like however she chose to deal with his illness is a personal choice. And I think that in the end we all make those personal choices, right? To either be there or not, to be there 100% or not. It's a
Uh-huh.
choice to make. So, I think she was just fortunate.
ability to do so. Question becomes, how do we protect our own health and needs from burnout when you have limited resources, when you have situations where those supports may be available, may not be available, financials.
Mm, mm,
But the key component, I feel like a larger conversation, what I feel like didn't happen, is how do we support each other when we found out that the person is becomes caregiver from employer perspective to social perspective, society and a larger society. I feel like that's conversation should have happened. How do we put together
A
resources that
support system.
will have the people have access to,
Mm,
regardless of their income,
mhm.
and have abilities to navigate that, right? And then maybe in terms of employer, maybe they would give some kind of flexible schedule so they can take care of their loved ones, be there present when need be. Also, in speaking on a larger society, if 60 million people are caregivers in America today, right, and how our government help? How do we actually think about it and have the conversation?
Can I jump in real quick, Alexi? So I know, for example, there's a lot of companies now who are putting in place as part of their health insurance, mental health services, that they have that service attached to their benefits. So if you're feeling burnout or you're feeling depressed or you're feeling overwhelmed, you, your loved one, whoever is on the insurance plan has access to speak to someone, a therapist, a social worker, psychologist, whatever. That's one plus. But there's a lot of people that we know that don't have insurance and don't have traditional work per se. They work off the books, they work part time, and they might not have access to those services. As a mom, when I was raising my girls, one of the things I would hear a lot of, it takes a village to raise children, especially raising my girls as a single mom. So I would say let that mindset be the same when it comes to asking for help and support for a parent or grandparent that you're providing care for. I would say tap into the senior communities, senior day programs, churches. If you don't have great relationships with your family members, appeal to their hearts and, in a compassionate way to say, hey, I need help. Who is willing to offer help? How many days can someone come by to step in to help me watch, bathe, do laundry, do shopping, take to doctor's appointments, spread the duties a little bit, if that is possible. If it's not possible, I would say definitely tap into taking that loved one to a senior program during the daytime when you're at work. Ask your company for flexible hours if you can, depends on the type of work you do. But I would say burnout is real and you have to be a little selfish. I'm adamant you have to be selfish. Because here's the thing, if I burn out and I drive myself crazy, who is going to take care of my family when I done go crazy and end up in the hospital? So no, I'm going to be a little selfish. I'm going to ask for help. I am going to push. I'm going to advocate. I'm empowering everyone who is listening to this podcast. If you're in a caregiver's role, and you're feeling overwhelmed and you're feeling burnt out and you're feeling stressed out, take a deep breath, take pen to paper, write down the things that you need for you not to keep feeling that way. So if you're doing caregiving 7 days a week and ideally you need help 3 days a week, figure out how you could either get home care or some type of assistance in the home to help with those other days that you don't feel so overwhelmed. I would say Go to the senior centers, connect with a church or a synagogue or a temple, whatever it is, where you can possibly get some additional help and resources if you're not already getting any from the city or the state in which you live in.
I don't know. I would like to talk about my job situation when I had to, miss work and take my mom on appointments. It kind
Mhm.
I guess it depends on the relationship you have with your job and how long you've been there.
Mhm.
But my job was just kind of like, "Oh, I'm sorry you're going through this." But
Mhm.
there was no additional, offer like, "Hey,
Support.
if you need time off or, let us know what we can do," because the job still had to get done.
Right.
And how I took it, and it was just like, "Okay, well, I'll figure it out. I will
Right.
figure it out and I will make this work somehow." And I feel like a lot of people are probably more in that situation where it's like,
Absolutely.
figure it out. I don't think that our culture is set up that way. I mean, again, depends on the job and the relationship that you have, but I think most people don't have that employer support or help that
No.
is necessary while you're caregiving.
I think that's why FMLA was one of the reasons why FMLA was created to offer that, take the time away from work
But
type
it's
of
not enough.
support. It's not enough. It's not enough. It's not enough. So I would always say advocate, advocate, advocate. Keep
Mhm,
beating down the doors. Keep pushing to say, okay, mom has Medicaid. How much hours can I get in home care for Medicaid? I know a lot of people who have Medicare and community Medicaid
mhm,
just for home care, just for those home care hours. There are so many resources out there, but it's to connect with the right person who's going to be able to answer those questions and
mhm,
help you advocate for what you need.
mhm,
That's a
Right?
part of it too. Let's go FMLA. You don't have to take the full FMLA at once. You could
mhm.
break it down. You
Right.
Right.
could apply for FMLA, and you could actually take only time periods when you need them to take.
Right.
Right.
So I don't think people realize that. You could take 1 hour, 2 hours, you could inform you apply for through your employer, and then you could say, "I need just to take 1, 2 hours on this date on
Right.
Mhm.
FMLA,"
Right.
and that's it. And you could
Right.
push out those 12 weeks to expand it to a whole year,
Right.
Right.
6 months, depends on the needs, depends on situation,
Right.
Right.
so it could last longer.
Mhm.
I think as we concluding this podcast, just what is your takeaway? What's your advice to individuals who are either start recognizing that they are caregiver or they're already in caregiver position right now and
Mhm.
they not sure what to do next?
I would say ask for help
Mhm.
and be strong and enjoy the time that you have with your loved one.
Right. I would definitely say ask for help and take time for yourself. It might be hard emotionally because guilt is a real factor. A lot of times, people feel guilty for wanting to have a moment for themselves once they step into this caregiver's role. But I would say, even if it's once a week, once a month, every other week, take time for yourself, breathe
Actually, I would disagree. I would say 5 minutes.
5 minutes
That's for five
every
minutes
day,
every day.
every day.
Put
Sometimes 5 minutes is not enough, Alexi.
no, but that's the thing. Sometimes time
To
you don't
start
know
at
where
five minutes.
you that's also can take the time. Because you don't feel you have time. And I always
Mhm.
say take 5 minutes. Put it
Takes
in
five
put
minutes.
it 5 minutes first. Put it in a calendar on your phone. 5 minutes. What's most you like to do? Listen to the music?
Every day.
It doesn't matter. Right. 5 minutes.
No, I'm just saying they have
And
to
then
do it
it
every
builds
day.
right. And then it's built up to 10 minutes. And
Right,
then it builds up to 15 minutes.
right,
And you do something that you enjoy yourself. Now, if
right.
you do something big, let's say do your nails if you're a woman, like if you like to do your hair or whatever you
Absolutely.
like to do, because it's also a male, right? A man too could be caregivers, not just female. That's a key component is that it starts with 5 minutes.
Mhm. Take some time for yourself. Do a lot of deep breathing. And I would always say this is something I advise individuals all the time. Give yourself grace.
Mhm.
Spend some time daily hugging yourself and giving yourself grace, because you're feeling guilty that you're not doing enough, or you're feeling guilty that you're feeling burned out. Give yourself some grace, but
Mhm.
take care of yourself.
Well, thank you very much for this conversation.
Wait, you didn't tell us yours. What's your advice?
Is my advice? No, Alexi said 5 minutes.
My advice is those 3 questions. I said earlier during
Yeah.
conversation, journal yourself. It starts with ourselves. The question is,
Right.
what's important to me first? What do I need if I get sick,
Mhm.
right? And write it up, and then come back with 5 years.
I think they should get the little pamphlet, the 5 wishes, and start with those 5 wishes. These are my 5 wishes.
No, that's even before I'm just saying, anyone right now on this call, and
Mhm.
what's important to me? That's the only question you need to have,
Mhm.
Right. Start there. Start
right?
there.
So grace is what, but we always have to give grace to each other and to
Mhm.
yourself,
Yes. Yep.
and sometimes hugs. How many of
Yep.
us hug? And it's not just hugging as a person, hugging ourselves.
Mhm.
Yes, I tell them, hug yourself. I can't tell you how many adults I've taught how to hug themselves. I say, I want
Mhm.
you to stand right there in front of me, take 5 deep breaths, hug yourself, and love on yourself right now and give yourself some grace. And they're like, right here in the hallway, right here in the hallway, right now, let's go.
And that's it. That's what we need to do. That's the first
Yep.
steps.
Mhm.
And then as Barbara pointed out, ask for help.
Mhm.
Ask for help. Absolutely.
So thank you very much for listening, and we'll see you next episode.
Yes.
Bye.
All right. Bye bye, everyone.